Now here's our reporter Laura Windsor with a segment on pediatric diabetes.
Diabetes mellitus is a chronic condition in which the body fails to metabolize food efficiently and can cause serious complications. Dr. Eba Hathout at Loma University Children's Hospital discusses the different types of diabetes in children.
There are two main types of diabetes mellitus in children, type 1, which is mainly insulin deficiency, and type 2, which is insulin dysfunction. Children at risk for type 2 diabetes are minority populations, people with a strong family history of type 2, and children who are obese. Obesity is a big enemy to insulin production. Keep an eye on the symptoms of frequent urination and frequent drinking, and if they notice any of that, to bring it up to their medical doctor. But without the symptoms, they need to also maintain a healthy weight, because obesity alone can be associated with type 2 diabetes without any other symptoms. The causes for type 1 diabetes are even more intriguing. Many thought it's immunologic, but we now think that it's also highly environmental, and we're doing research towards exploring prevention and cure through that venue.
Dr. Hathout talks more on type 1 diabetes and the research she has been doing.
The incidence of type 1 insulin-dependent diabetes is increasing throughout the globe, and the group with the largest increase in incidence is unfortunately the youngest, children under 5 years of age. This is a matter of interest for me in particular. I have studied the environmental effects that might have led to this exponential increase in incidence over the past decade for type 1 diabetes, and we found an association with exposure to ambient ozone since birth in children who develop type 1 diabetes. We are now looking into another mechanism that is also environmental and shows promise. Preventing type 2 diabetes boils down to the village: maintaining healthy eating habits, a healthy exercise pattern, losing the weight, and staying on the move. But type 1 diabetes is more complex, and I think the science is now looking into more of a cure, because prevention may be more complex at the present time. Type 1 diabetes has been typically thought of as the body's immune system attacking itself, autoimmune, and a lot of the cure and prevention strategies, which were very expensive, have been tailored towards that. However, we and others have data to show that it may not be that exclusively, and it may not be that at all in many children with type 1. So we need to keep an open mind about possible environmental factors, and also support scientific research towards exploring these prevention and cure strategies. Childhood diabetes has been my passion ever since my patient with type 1 diabetes and his parents were very compliant with everything I taught them, and the father said, "We did everything we can, now you go find a cure." And that's been 20 years. I focused on the islet, the focus of the disease in type 1 diabetes. I did research in islet cell transplantation, which is an emerging field with promise. I'd like to make it open for children. And I am now looking into islet healthy strategies for children who develop type 1 diabetes immediately as they are diagnosed, to give them the best chance for the future.
There is no cure at this time for diabetes, but it can be successfully managed with lifestyle changes without sacrificing quality of life. For the American Health Journal, I'm Laura Windsor.